Exhausted and frustrated, NHS staff worked tirelessly throughout the pandemic, but the relentless pressure has taken its toll, and staff shortages are now leading to fears for patient safety. Dr. Jackie Appleby has been a GP for 30 years and has never seen it so bad.
The solution is not rocket science, it's not difficult. We need more health workers, we need more doctors, we need more nurses, we need more porters, healthcare assistants, cleaners, we need more healthcare workers. And we're having to rely on agency workers, which is madness because they cost so much more.
The government had promised to increase the number of GPs in England by 6,000. Not only is it going to miss that target, the number has actually fallen by 700 in the last 3 years. The report by MPs paints a bleak picture of the NHS staffing crisis in England, with new research showing 12,000 hospital doctors are now needed. There's also a shortage of more than 50,000 nurses and midwives, and it's set to get worse. The report says an extra 475,000 jobs will be needed in health by the start of the next decade, as well as an extra 490,000 jobs in social care.
The real issue is that over many governments, we have not bitten the bullet on training enough new doctors for the future. And that's because we've always depended on immigration. We've always thought we can fill the gap if we don't have enough doctors in the NHS by bringing people in from overseas.
The government says hundreds of millions of pounds is going towards recruitment. But the problem is many staff are now leaving the NHS.
I've worked as a nurse for 47 years in the NHS. I left 18 months ago because although I loved my job forever and ever, I've absolutely loved it. It just became much too stretched. It was absolutely exhausting mentally and physically.
The report says the government has no credible plan to tackle the staffing crisis, but warns that urgent action is now needed to stop things getting worse. Layla Hayes, 5 News.